Welcome to the Deep Dive. Today we're tackling professional infection control. We're digging into the kind of foundational stuff from nursing courses, our mission, to pull out the really crucial, actionable knowledge you need, to understand how diseases spread and, more importantly, how the pros stop them.
And we really should jump right into the stats here because it shows why this matters so much. We're talking about HAIs, hospital-acquired infections. Basically, infections people pick up while getting medical care. The danger is pretty significant and often kind of hidden.
Okay, hit us with the headline number then.
It's pretty staggering, actually. CDC data from 2014 showed about 1 in every 25 patients gets an HAI. And these aren't minor things. They mean longer hospital stays, more treatments, higher costs, and they estimated around 75,000 deaths in acute care hospitals that year alone.
75,000, wow. Deaths just because a pathogen, that's the definition of infection, right? Invasion by a pathogen, got in while they were supposed to be healing. That completely changes how you look at something as simple as a hand washing station, doesn't it?
It really does. And the list of common culprits is, well, it's long. We worry most about things like CIUTI, that's catheter-associated urinary tract infections, and CLABSI, central line-associated bloodstream infections, C. difficile, pneumonia, MRSA, surgical site infections. It goes on.
And then there's the whole antibiotic resistance problem layered on top. Kind of a nightmare scenario.
Yeah, that brings us to MDROs, multi-drug-resistant organisms, things like VRE, MRSA, C. diff again. And what's really key here is that dealing with an MDRO totally shifts the approach. If you can't really treat it because your antibiotics don't work, well, prevention becomes everything. It moves from cure to just absolute relentless vigilance.
Prevention is literally life in that case.
Absolutely.
Okay, that makes understanding the timeline vital. Let's unpack the life cycle of an infection, the stages from entry to recovery.
Yeah.
Because that tells us when someone might be contagious, even if they don't seem sick.
Right. There are 5 key stages. First up is incubation. This is when the pathogen gets in and starts multiplying, but there are no symptoms yet, 0 findings.
Wait, so the person feels fine, the professional sees nothing wrong, but they could be spreading it.
Precisely. They don't know they're infected, but they absolutely can infect others. It's the silent spreader phase.
Okay, so that underlines why things like universal hand hygiene are so critical, right?
Yeah.
Because you just don't know.
Exactly. Then comes the prodromal stage. This is when you start getting those vague general symptoms, feeling a bit off, maybe run down. The pathogen's really multiplying now.
And then the specific signs hit.
That's the illness stage. Now you see findings specific to that particular infection, a rash, a certain kind of cough, whatever it might be. Hopefully the immune system fights back and you move into the decline stage. Symptoms start to lessen, and finally convalescence. The acute symptoms disappear, recovery begins, though that can take, days or even months sometimes.
Okay, when professionals are classifying these, what's the most important split we need to understand? Local versus
systemic. Yeah. A local infection is stuck in one spot, like a wound infection or maybe an ear infection. Symptoms are right there. Swelling, pain, redness, warmth.
But systemic sounds much worse.
Oh, it is. It means the infection has spread through the body, usually via blood or lymph. Think septicemia, blood poisoning.
So the signs aren't just in one place anymore.
Right. The whole body reacts. You get fever, chills, malaise, that general feeling of discomfort, fatigue, maybe increased heart rate, faster breathing. We also talk about primary versus secondary infections. A secondary one kind of piggybacks on the first, like getting bacterial pneumonia after a viral cold has weakened your defenses.
Got it. And when assessing someone, besides those physical signs, fever, chills, maybe confusion in older adults, which is a key point.
Yeah.
What do the labs show? What's the definitive proof?
Well, besides those general cues, and yeah, for older adults, sudden agitation or incontinence can be a sign. Labs are key. 2 main things. First, leukocytosis.
Meaning white blood cells.
Exactly. White blood cell count over 10,000. It's the body sending out the troops, basically.
And the second lab marker.
An elevated ESR, erythrocyte sedimentation rate. If it's over 20 millimeters per hour, that indicates inflammation somewhere in the body. It's not specific just to infection, but combined with high white cells, it strongly points that way.
Okay, so we know the enemy, we know its playbook. Now for the really interesting part, how do we break that chain? Let's talk strategy. The layers of defense, starting with the absolute basics.
Right, the foundation is standard precautions. This is the minimum level of infection prevention used for everyone. Every single client, doesn't matter what their diagnosis is, it applies to all body fluids except sweat, interestingly, plus non-intact skin, mucous membranes. It covers hand hygiene, PPE, sharp safety, cough etiquette, just basic good practice.
And basic nursing interventions too, right? Like encouraging immunizations, oral hygiene, deep breathing exercises, cleaning equipment between patients.
Absolutely. Those are all part of that standard baseline care.
But sometimes the baseline isn't enough. When you know or suspect something highly infectious, you need more.
Correct. That's when we add transmission-based precautions on top of standard precautions. And these depend on how the specific pathogen travels.